So I had my first ECT treatment today. Went to the clinic, had to sign some forms consenting to the procedure. They took me back, started an IV. They had me go to the bathroom because a lot of the times when they introduce the electrical stimulus, your body involuntarily goes to the bathroom. So as a precaution, they do that. Then they took me to the treatment room. I sat in sort of a recliner chair thing. And then I got an injection of a drug called an anticholinergic, which counteracts bradycardia, which is a slower than normal heart rate. When they introduce the electrical stimulus, you have bradycardia for a few seconds. It's lower than 60 beats per minute, and the drug helps, prevent that. And then after the bradycardia, your body actually does the opposite and goes into tachycardia, where it's more than 100 beats per second, and raises your blood pressure. So the drug is to prevent the bradycardia and asystole, which is when your heart stops. So, and then after that, the anesthesiologist came in, and the doctor who would be doing the stimulation, they put monitors on my chest to monitor my heart. They attached the electrodes to my forehead. And then they administered the sedative, and I was out. When I woke up, they said everything had gone well, that a seizure had lasted about 10 seconds, and that I'd been under sedation for about 20 minutes. Took me about half an hour to be awake enough to be discharged. When I woke up, I had a horrible headache, possibly the worst headache I've ever had. I was also incredibly thirsty, because one of the side effects of the anticholinergics is dry mouth, and I've drunk so much the rest of this day, trying to combat that. Anyway, they brought a wheelchair, and he wheeled me out to the car. My mom drove me home, and then I was still very, very tired, so I took about a 3.5 hour nap. I took something for my head. When I woke up, my head was feeling much better. And so I'm going to be receiving the treatments on Tuesday, Thursday, and Saturdays. So my next treatment will be next Tuesday. So one down.